Hello, doctors. My name is Dr. Nitin. Your patient waiting area is a place which can make or break your clinical practice. So, today we are going to talk about the patient waiting area in your clinic or hospital setup. You might not believe it, but it is one of the critical area is your patient waiting area. It can be a source of dissatisfaction for your patient, or it could be a place of potential revenue for your future clinical practice. So, let me elaborate more on this. Uh, I can see and I can sense that your clinic is fully fledged, it is fully working, and there are so many patients waiting in your patient waiting area. You might be thinking it's a very good sign. So let me tell you, apparently it seems a good situation, but there might be some potential problems which might be hidden b- behind this rush in your clinic. Let's begin with the first point. So it indicates that your clinical practice is dependent on your physical presence. You might need to think over it. What is going to happen if you are not there present in your clinic? That is first point. Second point that I want to ask you, I want to question you. Do you think that there is a rush? That means uh, you are able to provide satisfaction to your patients? I mean, it might be possible that it's an indication that you are not able to manage the rush in your clinic. I want to ask you third question. It could be also indicator of your staff is not efficient to control or manage that rush in your clinical practice, because that rush is not being handled properly. The appointment system is not being followed properly. So these are the some of the high level points or concerns that I want to raise with you. I'm not saying that it is present in your clinical practice. It might be present, this kind of situation in your clinical practice. So you need to do that self introspection, whether are these are the problems that are present in your clinical practice. If these problems are not there, that is a very good sign, and that rush indicates a very healthy sign for your clinical practice. But if not, you need to think and evaluate how you are going to manage that patient crowd in your waiting area. And if you think that, or if you wish that you want to convert that uh, your waiting area and the patients in your waiting area into a source of potential revenue in the future, please get in touch with me and I will help you. I will guide you with the personal consultation about growing your clinical practice and how you can convert that rush or that crowd into a potential source of revenue in your future clinical practice. So that's all for now. This is Dr. Nitin signing out. Bye bye.